Over the last 24 hours, we've had 48 new cases. Right now, we have 309 active cases. And our hospitalization, we have 13 people in hospital, 10 at Ocean View, and 2 of those in the ICU. 5 of our patients require oxygen right now. Yesterday, we had 300 and something doses that were administered, and we continue to talk to people to see how we can increase those numbers. Because after 6 months, the antibodies in your system would wean, it would drop. And if it dropped, then you're not so protected. So to keep the levels of antibody high in your system and to fight off infection, then you need to get a booster dose. Monkeypox was discovered since the 1950s, and there was a set of monkeys that were shipped to Europe, and they were for scientific experiments. And that shipment that came to Europe, they discovered that they had a particular disease, and that's why the name monkeypox was given to the disease, because it was first found in monkeys. Uh, but monkeys are not the real host of the disease or the reservoir of the disease. Other animals are. Monkeys are just incidental hosts of the disease. So, but the name has stuck. And from time to time, you would have um, outbreaks, not with large amounts of cases outside of the endemic area. The endemic area is Western and Central Africa, but from time to time you would have outbreaks. So it's not a new disease, it has been around for a while. What is new is that we, this time around, there have been many more cases outside of the endemic area. And that's why people are very cautious and have taken measures to try to curtail the spread of monkeypox. So right now there are probably about 45,000 cases globally in about 96 countries. Monkeypox is transmitted from animals to humans. So if there's an infected animal, they can, a person come in contact with them, they can get infected. So that's the first form of transmission. And then you can have human to human contact. So that's the second major form of transmission. In terms of the human to human contact, that can be done in 2 ways. What we might call a direct contact, meaning that if you are in close proximity with someone who's been infected, then you can get the virus. If somebody who is infected, if you're touching the lesions, cleaning the lesions, not using protective gear, then you can get infected. So that's direct contact. And then you have indirect contact, because they have found that monkeypox can be on surfaces. So if somebody is who has monkeypox in a ward, for example, they're infected, and you go and you don't have on gloves and you touch those surfaces, the chances are you can come in contact with the virus. So once people take precautions, I think they should be fine. It's not a virus that would readily transmit, but if you stay long enough close to somebody who is infected, you can get monkeypox, especially if you're not wearing protective gear. There are very few medications that are currently available to treat the virus per se. So right now they're working on 3 different antiretroviral. They're in limited supplies in the United States, and they are being used under emergency use authorization. The second thing in terms of perhaps treating patients or persons exposed to monkeypox is to make sure that we can have a vaccine for those persons who are exposed. So we have placed an order with PAHO, and we are expecting that we will get some of those vaccines by the end of September. The treatment for these persons when they get infected would be symptomatic. Therefore, if they have fever, we'll treat fever. If they have an enlarged lymph node, we'll treat that. Generally, persons would resolve within 14 days, maximum 21 days. Most people who get infected within 21 days, they would be fine. There are very, very few examples where they can develop some complications, and that is because of secondary bacteria infection. So on top of the monkeypox, they might get another bacteria, a bacteria invading the lesions that they have and creating an additional disease. So we have to be mindful of that when treating patients with monkeypox. They are in the same family, but what has been shown, persons who are older than 40 more than likely might have received a vaccine for smallpox. And if you had such a vaccine, then it helps to prevent you from getting monkeypox, because it's effective both for smallpox and monkeypox. But the world has eliminated smallpox, and therefore we have stopped vaccinating people for smallpox. So about 40 years ago, we've stopped doing that globally. And hence you see the resurgence of things like monkeypox, because people are no longer vaccinated. So for people who are older and would have had this smallpox vaccine, they should be protected. Well, all our patients we treat it with strict confidentiality, so this would be no exception. Right now, the existing hotlines that we have for COVID-19, where people can call in, we have expanded that to include monkeypox.